Hi, and welcome to Chapter 7, CPR and AED. Let's take a look at heart attack and cardiac arrest. A heart attack happens when the blood supply to the heart muscle is suddenly reduced or blocked. If the blocked artery is not reopened quickly, the part of the affected heart begins to die. And the longer a person goes without treatment, the greater the damage and can lead to cardiac arrest. Cardiac arrest happens when the heart stops beating or when it suddenly develops a rapid irregular rhythm or ventricular fibrillation. Cardiac arrest is one of the leading causes of death. Cardiopulmonary resuscitation or CPR. Cardiopulmonary resuscitation is the set of skills necessary to help a person in cardiac arrest until emergency services or EMS takes over. CPR for a child is similar to that given for an adult with a few key differences. An automated external defibrillator or an AED is an electronic device that analyzes the heart rhythm and, if necessary, prompts the rescuer to deliver an electric shock to the heart of the person in cardiac arrest. CPR for a life-threatening condition, cardiac arrest, doing something is always better than doing nothing. Use RAB-CAB mnemonic to remember the sequence of events to do when providing adult or child CPR. R, responsiveness. A, activate EMS and get an AED. B, breathing. C, compressions. A, airway. B, breaths. So R, responsive. Tap the person on the shoulder and shout, "Are you okay?" If the person responds, ask sample history questions and look for and ask about dots. If the person does not respond, continue to the next step, activate. A, activate EMS and get an AED. Shout for nearby help. If someone responds, have them call 911 and get an AED while you provide care. A, activate EMS and AED continued. If no one comes and you are alone with an adult, call 911 and put the phone on speaker mode. Prepare to follow the dispatcher's instructions. If a phone is not available, leave the person and locate a phone to get an AED. If no one comes and you are alone with the child, give 5 sets of 30 chest compressions and 2 rescue breaths before calling 911. B, breathing. Place the person up on a flat, firm surface. Take 5 to 10 seconds to observe the person from the neck to waist for movement, so rise and fall of their chest. If the person is not breathing or is only gasping, continue to the next step, compressions. Compressions. Provide chest compressions. Move enough clothing to locate the correct hand position for compressions and where to apply an AED when it arrives on scene. For an adult, place the heel of one hand on the center of that person's chest and on the lower half of their breastbone or sternum. Place your other hand on top of the first one with your fingers interlocked. Hold your fingers off of the person's chest and point them directly away from you. Do not cross your hands. For a child, you use one hand. However, depending on the child's size and your size, using 2 hands may be necessary. Keep your arms straight and your elbows locked with your shoulders positioned directly over your hands. Push hard and straight down on the breastbone, at least 2 inches or 5 centimeters for an adult, and about 1/3 the depth of the chest for a child. Use your upper body's weight to compress the chest, but you do not rock back and forth. Push fast, 100 to 120 compressions per minute. It may be easier to push to the beat of the Bee Gees song, Staying Alive, or the beat from a CPR smartphone app that was previously installed as long as it's quickly accessible. Push smoothly. Do not bounce or jab, and do not stop at the top or bottom of a compression. Allow the chest to fully recoil after each compression. Do not lean on the chest. So, airway. Open the person's airway. Take your hand, which is nearest to the person's head, and place it on their forehead. Apply pressure to tilt the head back. Place two fingers of your other hand under the bony part of the person's jaw near the chin and lift. Avoid pressing on the soft tissues under the jaw and tilt the head backwards. B. Breaths. Give two breaths using a mouth to belly device when possible. Pinch the person's nose shut and make a tight seal with your mouth on the mouth to barrier device or the person's mouth. If unwilling or unable to give breaths, give compression only CPR instead. Breaths continued. Give two breaths, each lasting 1 second. Do not blow too forcefully or for too long, and take a normal breath for yourself after each breath. Watch the chest, see if it rises to determine if your breaths go in. Allow for the chest to deflate after each breath. If you see the chest rise after two breaths, give 30 chest compressions. If the first breath does not make the chest rise, retilt the person's head and give a second breath. If the second breath does not make the chest rise, begin CPR, 30 compressions of two breaths. Each time before giving the first of two breaths, open the mouth and look for an object, and if you've seen it, remove it. Continue cycles of 30 compressions and two breaths until an AED arrives. If a bystander is present, they can help by giving chest compressions while you perform the rescue breathing, or vice versa. When an AED becomes available, use it as soon as possible, and you want to follow the manufacturer's directions for pad placement. Compression only CPR. Compression only CPR or hands only CPR is CPR without breaths. It intends to increase bystander involvement when CPR is needed for a person in cardiac arrest. It may be used with adults or children, but not infants. It's important to note that breaths are an important part of CPR with infants, and compression only CPR can actually be detrimental for infants. A bystander who is unable or unwilling to make mouth to mouth contact or unable to perform CPR can ask another person to call 911 or an emergency response number. Place the person on a face up on a flat, firm surface. Push the center of the chest hard and fast, faster than 1 per second, or use the beat of the Bee Gees song, Staying Alive, or a smartphone app that was previously installed and is quickly accessible, or a dispatcher's directions heard over a mobile phone speaker. Continue chest compressions without stopping or until help arrives as long as possible. If another person is available, you trade off about every 2 minutes. COVID-19 is an illness caused by a virus that can spread from person to person. A person can become infected from respiratory droplets when an infected person coughs, sneezes, or speaks. This presents a dilemma for a first aid provider who is concerned about compromising their own health, yet wants to give CPR. If a person known to be infected with COVID-19 virus is in cardiac arrest, perform compression only CPR with the addition of covering the person's nose and mouth with a cloth or face mask, and the first aid provider wearing a mask to cover their own nose and mouth. So, CPR performance mistakes, rescue breathing mistakes. So, that's failing to ensure adequate head tilt chin lift. The airway will be closed. Failing to pinch the nose shut in a child, an adult, or not covering the mouth and nose of an infant. Failure to give slow breaths. They need to last 1 second each. Providing breaths that are too fast or too forceful, failing to watch the person's chest rise and fall, failing to maintain a tight seal around the mouth or barrier device. Chest compression mistakes. Pivoting at the knees instead of the hips, so that's a rocking motion. Using the wrong compression site, that's too high or too low on the chest. Bending your elbows. Your arms should be kept straight with elbows locked. Failing to place shoulders above the sternums. Arms should be vertical. Touching your fingers to the person's chest. If you provide quick stabbing compressions, failing to allow the chest to fully recoil. So that's if you're leaning on that chest. Failing to keep your hand in contact with the person's chest between each compression. Airway obstructions. Signs of a mild airway obstructions or choking is you still have good air exchange and you're able to make a forceful coughing effort in an attempt to relieve the obstruction. What to do for a mild airway obstruction or choking? Encourage continued coughing. Monitor the person until they improve. Signs of complete airway obstruction: difficulty breathing, unable to cough forcefully, unable to talk, skin, fingernail bends, or lips turn blue or gray, if they appear panicky or desperate, and they're pointing to their mouth or grasps at their throat. The American Heart Association recommends providing abdominal thrusts for dislodging a severe airway obstruction choking in a responsive child, a responsive adult, and a child older than 1 year. The International Liaison Committee on Resuscitation recommends a combination of back blows and abdominal thrusts. So that's 5 back blows followed by 5 abdominal thrusts for airway obstruction. An airway obstruction is a life-threatening event, so it is a good idea to know several procedures that can be taken if others have failed. Before administering back blows or abdominal thrusts to a person who is responsive and shows signs of complete airway obstruction, do not ask them if they are okay. Instead, ask them if they are choking and if you can help them. If they nod yes, then you are going to help. Have someone call 911. Back blows, adult and child choking. Stand behind the person and slightly to one side. Place the palm of one hand high on the person's upper chest, leaving your other hand free. Have the person bend over at the waist at a 90-degree angle. Their upper body should be parallel to the ground or floor. Do not keep them in an upright or vertical position. If they are not bending over when the jolt of the back blow dislodges the object, the dislodged object may become stuck deeper in the airway. With your fingertips up, use the heel of your hand to firmly strike the person between their shoulder blades. If 5 back blows do not dislodge the object, give up to 5 abdominal thrusts. If 5 back blows do not dislodge the object or the person is still unable to speak, give up to 5 abdominal thrusts. Stand behind an adult. Stand or kneel behind a child. If the person is a lot taller than you, you can have them kneel or sit. Wrap your arms around that person's waist. Locate that person's navel and a couple of fingers. Right-handed people will usually use their left hand. Make a fist with the other hand. Right-handed people usually use their right hand and place the thumb side of that hand just above that person's navel and below the tip of their breastbone or sternum. Grasp that fist with the other hand. Thrust the fist into the person's abdomen with a quick upward motion. Each thrust should be separate and a distinct effort to dislodge the object. If the obstruction is not dislodged and is still in place, repeat alternating back blows and abdominal thrusts until the person can cough, forcefully breathe, or speak, the person becomes unresponsive, or EMS or someone with more advanced training takes over. If the person becomes unresponsive or a person is found unresponsive, you then look in the mouth for an object. If seen, remove the object, Then provide CPR by doing the following. By giving 30 chest compressions, you give 2 breaths. If the first breath does not cause the chest to rise, re-tilt the head and attempt a second breath. Continue sets of 30 chest compressions and 2 breaths. Each time before giving the first of 2 breaths, look into the mouth for an object, and if you see an object, remove it. If the person is pregnant or very large, or if you are small, provide chest thrusts. Position yourself behind the person. Put your arms under the person's armpits and your hands on the lower half of the breastbone or the sternum. Pull your hands straight back into the chest. So chest thrusts are similar to CPR chest compressions, but are sharper and delivered at a slower rate. Hands are placed on the lower half of the breastbone. Infant choking. Give up to 5 separate and distinct back blows. Support the infant's head with your hands. You want to lay the infant face down over your forearm with the head lower than their chest. Brace your forearm and the infant against your thigh. If holding the infant with your right hand and forearm, brace them against your right thigh. If using the left hand and arm, brace them against your left thigh. Give 5 back blows between the infant's shoulder blades with the heel of your other hand. If the object does not come out, turn the infant onto their back while supporting their head. Give up to 5 separate and distinct chest thrusts. Support the infant's head with your hand. Lay the infant face up over your forearm, tilting your arm down so the infant's head is lower than their chest. Brace your forearm and the infant against your thigh. Place 2 fingers of your other hand in the same location as giving CPR compressions. Give the thrusts 1 second apart. This is not as fast as CPR compressions. Continue alternating the 5 back blows and 5 chest thrusts without interruption until the infant stops responding or can breathe, cough, or cry, or until EMS or a person who is trained takes over. If the infant is found or becomes unresponsive, give 30 chest compressions, look into the infant's mouth for an object. If seen, remove it and give 2 breaths. AEDs. An AED analyzes the heart rhythm to determine if an electric shock is necessary. If it is, the AED will prompt the rescuer to deliver the shock to the heart of a person in cardiac arrest. The purpose of this shock is to correct an abnormal electrical disturbance and reestablish a heart rhythm that will result in normal electrical and pumping function. Using an AED as soon as possible increases the person's chance of survival. Many AED models exist. The principles for use are the same for each, but the displays, controls, and options vary slightly. Don't let this intimidate you because most have voice prompts or visual displays to guide usage. Using an AED. You turn on the AED. Attach the pads to the person's bare, dry chest as shown on the pads. If needed, plug the cables into the AED. Stay clear of the person. Make sure no one, including yourself, is touching the person and say, clear. Allow the AED to analyze the heart. The AED will prompt one of 2 actions. Stay clear and press the shock button if advised to deliver a shock. Do not shock, but give CPR, starting with chest compressions and the pad staying in place. After one of the 2 actions, give 5 sets of CPR for approximately 2 minutes, unless the person moves, begins to breathe, or wakes up. Even if the person wakes up, leave the AED pads on until EMS arrives. Repeat clearing the person and allowing the AED to analyze the heart until the person begins to breathe or until EMS takes over. And thank you. Thanks for joining.